everybody. I am recording this after the fact. We could not get basically the Wi-Fi. It wasn't working earlier, so I do apologize. For those of you watching right now, this is likely going to be a recording sent to you, to all of those people who RSVP'd. So I truly apologize. But for further ado, let's get started. Let's get this thing going. So. This is Balanced and Thriving with me, Betsey. I'm a board certified physician assistant. I did traditional practice for approximately 9 years. And now I'm just basically doing functional medicine, a lot of hormone therapy, integrative health. Today, we're going to be talking about early detection cancer screening, a new revolutionary test that we offer here at TrueBody that I believe everybody should know about. So this is a real statistic. 1 in 2 men and 1 in 3 women will be diagnosed with cancer in their lifetime. So how do we try to catch things before it gets ahead of us? So I have a particular patient that I can think of, more than one really, but one particular patient who was diagnosed with a lung cancer middle of life. So believe the initial diagnosis was at 38, and I consider that pretty young. I'm not very far away from being 38. Basically what happened is they went in for just like a routine check, ended up getting a chest x-ray and found a large mass. This patient had never smoked, never vaped, never really participated in any negative activities. They also didn't work in a mine or around chemicals. Like, it just really didn't make sense for this to be the actual diagnosis. And unfortunately, even as young as this person was when diagnosed, was already stage 4 and metastatic. And so obviously this isn't necessarily something that I'm going to say, oh, you need to start screening before the age of X. This is really for peace of mind for a lot of people, but we don't have screening for lung cancer. We don't have screening for a lot of different cancers. And so basically what this test is going to do is it's going to allow us to test for things that we can't screen for normally. There's no scans that we typically do or blood panels that we can typically run. And it's looking at like a different aspect of cellular signals that may detect cancer early. And this particular case really just broke my heart. Obviously, this is a very young person, very devastating diagnosis, something that is not treatable or curable. There's no really explanation why. At the time, I didn't have the training I have now, and so genetic testing would probably have been a great thing to do, just to see if there was maybe a genetic reason of why this diagnosis happened. You would have thought maybe like an oncologist or somebody else would have thought of that as well, but I don't believe any genetic testing was ever completed. But it's cases like this that scare the bejesus out of us. I'm sure each one of you listening to this or watching this at some point knows of somebody who was diagnosed with a cancer, and maybe like a cancer that they never saw coming. And that's why this test, I think, is revolutionary. I also believe that we should be living in an age of medicine where we're really trying to prevent these things from happening, like optimizing our health and really looking towards, never getting a diagnosis like this. So getting genetic testing done early, making sure we don't have any mutations. And if we do, trying to stay ahead of it and how to mitigate it and what screenings do you do. But also doing screenings like this, early detection. So, if you have a mutation or not, like, you're still being screened, because you don't have to have a mutation. You don't have to have really anything. Sometimes you just got a bad dealt card, or whatnot. And this is just your new reality. So I believe in preventative medicine, and that's what I'm firmly going to stand on. And I want anybody who comes to see me to understand that we're here to optimize your health and to prevent things from happening to you in the future as best as we possibly can. And there's things that we're not going to see coming, but if we can mitigate them as much as possible, that's what this is all about. Let's keep going here. Okay, so what's the problem, or the problem? Why traditional screening isn't enough? The logo is over top of that. Sorry about that. Isn't enough. So right now we've got ability to screen for breast cancer with mammograms and colon cancer with colonoscopies and cervical cancer with pap smears. That's about it. Those are kind of the big ones that we screen for. Um, Prostate cancer, we do a PSA blood test, but nothing, significant there. A lot of times that can be falsely um, elevated or whatnot. So what we have right now is a very limited scope of cancers that we're really able to screen for. And typically a cancer, so we know based off studies that cancers grow for approximately 5 years before they're detected by most of our screening mechanisms, whether it be a mammogram or a CT or whatnot. And the reasons why we usually go in for these things is because we notice something or we feel something, and a lot of times that's too late. A lot of times, in this particular case, this person came in and was just having some shortness of breath, and by the time there was shortness of breath, it was metastatic, stage 4. So, just things to think about, and this is kind of why we have a problem. This is not downgrading mammograms or colonoscopies in any way. I still highly encourage everyone to still participate in those at a rate suggested by your provider based on your personal history. This is just an extra tool to add to your toolbox. Okay, so what's the solution? So the solution is GRAILS, Multi-Cancer Early Detections Test, MCED. So what is the test? It's an advanced blood test that looks for over 50 different types of cancers. It detects cell-free DNA, so cancer signals that are floating in our blood. There's no fasting, there's no radiation. It's just a simple blood draw. It uses advanced genomic sequencing and AI to detect the signals, which is pretty remarkable. And the types of cancer, there's a lot. There's over 50, but the big ones that you can't screen for are listed here, which I think is really great. So ovarian, liver, pancreatic, esophageal, stomach, blood, lung, and more. All of these have no standard screenings. None of those do. It's safe. It's an FDA breakthrough designation. It's been studied in over 300,000 people. So pretty remarkable so far. So who is it for and how often should you get it done? I highly recommend anyone over the age of 40. Obviously, if you have a significant family history or genetic mutation, that may change, but I would say 40 is kind of like your starting point. I would recommend repeating the test every 3 to 5 years, depending on the result you get and your personal risk. That may change. It's not meant to replace those current screenings. Like I said, I still, recommend mammograms, breast MRIs, colonoscopies, all the routine things. This is additive. Think of it like a comprehensive snapshot. It's really like peace of mind. Really just you got your mammogram. When that mammogram result comes back and it says all is normal, you're good for another year. Like you do have peace of mind, whether you think about that or not. You're like, oh, thank God. Yep, it was great. So that's exactly what this test is going to give you, but it's just going to give that to you for over 50 different other cancers. So what's the cost? The cost is about $1,800. It's a one-time out of pocket. It's not currently covered by insurance. I do foresee that changing. I wouldn't wait for that to change. Gosh, they've been saying that about a lot of different things, women's testosterone being one of them. But it's out of pocket for right now. And so why is it worth it? So the cost of treating a late stage cancer is obviously astronomically higher, financially and emotionally. And I wouldn't want anybody to have to undergo that. If you wanted to break it down even further, it's about $1 a day for 5 years. And if you do the test every 5 years, then there you go. It's just $1 a day, cheaper than your coffee. How it works, basically you would just call the office and we get you in for a blood test, and we would we would call you, let us know you want to do the test. We'd order you a kit special. They would mail us the kit in office once the kit comes in. then we let you know, come in for a simple blood test. We mail it off to the company. They're the ones who analyze it. They send the results back. And then you and I sit down together and we go through those results and what that looks like. I have on here results can be back within 10 to 14 days. I err on the side of caution because I don't want you to be scheduled and then we don't have anything to talk about. So I usually say about a month in between, but that also changes. Sometimes the labs are quicker and they might be a little bit quicker about it in the future, but as of right now, that's what's looking like. So genetic testing and cancer risk. So knowing your blueprint, like I said, is really important. Like this particular patient, had they known if they had a genetic risk, may have done some screening a little bit sooner, right? We'll never know if there was a genetic component to that person's cancer or not. But when you offer genetic testing and things like this, it really gives you a very comprehensive view on like what you need to be doing, because there's a lot of cancers tied to specific mutations that are like kind of a gamut of things. For example, my ATM mutation, prostate cancer, breast cancer, and pancreatic cancer are all linked to it. And so I had a bilateral mastectomy, so I don't have to worry about the screenings for breast cancer since I have no breast tissue anymore. However, I still have a pancreas, and my brother, who tested positive, still has a prostate. And so I still will do this test on a regular basis just to make sure I don't have any cellular signals that might be cueing something for pancreatic cancer. There's currently no screening for that, but my genetic mutation is directly linked to it, if that makes sense. So obviously there's other mutations. There's BRCA, there's Lynch syndrome. There's so many different mutations out there, and all of those are related to other types of cancers. Some that have some testing available, some that don't. Some of the testing that is already, or screening that is available right now, is meant to be detecting a cancer in a later stage, not necessarily an earlier stage. So just think about that too. It also helps you guide your lifestyle. I mean, if you know that you're predisposed to getting something, you might want to change a couple things, right? And based on your genetics, it can give you keys to that, piece to that puzzle, like whether it's, maybe I need to avoid, processed meats and salamis and things like that because I'm more prone to like a colon cancer down the road. And we know that there's a direct link to those processed meats and colon cancers. And there's just so much you can really gain from this to really help prevent, even if you had a mutation, obtaining that. Not every cancer is able to be mitigated, like how I have a bilateral mastectomy now and I don't have any breast tissue. It's not like I can just take out my colon if I was predisposed to having colon cancer. It's not like you would just want to remove someone's pancreas. You can cause a slew of other problems with those things. And so the things you can't really mitigate, you're kind of looking towards lifestyle. What could I do in place of this? So there's that too. Hormone therapy, supplements you should or shouldn't take. There's definitely a lot to it, and understanding that blueprint is so powerful. Bonus in the functional realm, obviously we can look at your genetics and how they're tied to like how you detox. Are you more prone to inflammation? Are you prone to like working with methylated things, non-methylated things? A lot of other things in here, not just obviously diseases. Okay, inflammation and chronic disease, the root cause of most cancers. So chronic low-grade inflammation is often the root cause of many cancers, even before symptoms appear. And there's some blood tests you can get, like CRPs and ESRs, that are specific blood markers that can help us cue into like certain inflammation within the body. However, there's a lot of times though you don't really have like specific markers that are cued just because we have inflammation. And sometimes the symptoms we have is just like, oh, my gut is all messed up, whether I'm bloated or a diarrhea or a constipation. Maybe it's a blood sugar imbalance or an environmental toxin or hormone issue or nutrient deficiencies. And so really what you're kind of looking at is like, okay, do I have inflammation in my body? And if I do have inflammation, I will be more prone to developing an illness or cancer down the road. And we just know that that's proven. So really trying to look at and mitigate that inflammation in your body is paramount. And this inflammation could just simply be from stress in your life, whether it's your job, your family, like just things that come and go. So really important to just keep an eye on that. You don't really want to wait for a disease to show up on a scan, like a mammogram. It's more you want to just get ahead of it before it even does. Hormone optimization and cancer. I get this question. I get the question constantly. I heard hormones can cause cancer. That has been flat out debunked. There are specific synthetic hormones out there that did cause cancer or increased risk of cancer. Those were progestins, and we no longer use those. I personally don't use any synthetic medications in my patients. So when it comes to hormone therapy, no, hormones do not do that. It's good to be educated on that. Also, we try to use bioidentical as much as absolutely possible, or even micronized hormones. Newer research shows that balanced hormones, especially progesterone and testosterone, may actually help reduce cancer risk in many people. So it's important to understand those studies and really advocate for yourself, because this is not traditionally taught in medical programs. Obviously, if you're estrogen dominant, whether you're on estrogen or not, if you're estrogen dominant and you have a uterus and things like that, it could increase your risk. If you have that chronic inflammation or you do not detox properly, your risk is going to be higher than that of somebody else. So getting a full picture of your genetics, your labs, your history is really important before starting therapy, obviously. And just really understanding and being educated in hormone therapy is really helpful. See here, peptide therapy for prevention. Let's see here, peptide therapy for prevention and repair. So I've talked about this in my last webinar on peptides, but certain peptides like thymosin alpha, KPV, BPC157 help modulate the immune system, reduce inflammation, promote cellular repair. So mitigating cancers from even forming, in other words. GHKU copper, basically is going to help support DNA and anti-aging processes. These are not replacements for screenings, though. These are helping you to optimize your health and reduce risk of developing a cancer, but these are not going to replace screenings. Just flat. They're just not. Peptides, they basically support your body's natural immune system and immune function, which is going to help people. And so, yeah, I just understand that there's a difference there. Annual labs are not enough. They're definitely not enough. Most annual labs just cover 4 to 5 basic markers. This is honestly exactly what I would run on patients in a traditional office, is a CBC, CMP, their lipid panel, and maybe a TSH. And that was it. That was once a year, and that's all we did. And often patients would come in and be like, oh, I'd be like, oh, your labs look fantastic. They're so good. And they'd be like, oh, great. So there was nothing that could explain if I had a cancer or something. And truthfully, no, they didn't show that. But was I looking at enough things to really say that? Probably not, right? Labs are going to give you a small insight into someone's health and are typically not going to be abnormal until things have progressed. So just getting annual labs is going to miss early detection of things. Obviously, annual labs aren't going to cover hormones. They're not going to cover where baselines are. Your provider may not even know how to read those levels and give you, proper recommendations on what that would look like either. So, basically, labs aren't enough, I guess, is the bottom line. You could pair a full panel of labs and the Gallery test together, and that would give you pretty good insight into things. I would encourage you to get a more comprehensive panel than just a wellness panel in addition to the Gallery test, just to know what your risks are. Okay, so I believe that's it. Again, I apologize. For those of you watching this, it won't really matter since it's going to be recorded anyways, but for those of you who RSVP'd, truly apologize. this offer will still be good through tomorrow. So, and I'm gonna email this out to you guys. So for 24 hours, if you guys do book a visit for the early detection cancer screening, you'll get 15% off the test. Obviously, if you're a VIP and your discount is more than 15%, we will honor the more than 15%. But if you're a VIP, you'll also get 10% off any peptides you would want to try. In office, we have BPC 157 and BPC 157 paired with KPV. So they look like this. I also have NAD that qualifies. So this is NAD. This is one capsule. This is KPV plus BPC 157. So the ultimate gut hack as far as repairing your gut, things like that. And then this one is just straight BPC 157, and this is a chewable. So you can get a % off that. So I, again, apologize, but I think this is a really great test. So I wanted to get it out to you guys as fast as I could. This is legitimately, you do not have to wait for symptoms anymore. If you act now, then you might catch something before it is something. So that's all I've got. I hope you guys have a good rest of your night. See you next time.